Hi, I'm Dr. Nezami, board-certified plastic surgeon. I have been performing body contouring procedures since 1981. If you are thinking to reduce your midsection, you may not know if you are a better candidate for liposuction, mini tuck, or tummy tuck. It is very simple. Liposuction removes the excess fat and decreases the thickness of any roll you can pinch on your abdomen, but does not remove or tighten excess skin. Tummy tuck can remove roll of lax skin and underlying fat on your lower abdomen and tighten your abdominal skin and abdominal wall. But there is a long scar in the bikini area and around the umbilicus. Mini tuck remove a smaller amount of skin and fat and only on the lower abdomen without any changes in the upper abdomen. But the scar is shorter and there is no scar around the belly button. On a different video titled, Can the fat go to different area after liposuction? I talk about liposuction and I encourage you to view that segment. Tummy tuck is done with the long incision from hip to hip in the bikini area. The remaining scar can be well covered with the bathing suit. Then the skin and the fat are separated from the abdominal wall muscle and lifted to the level of the belly button. The incision is then made around the belly button, which is left attached to the deeper tissue for blood supply. The skin and fat is then lifted all the way up to the xiphoid, which is the lower part of your chest bone. The lax muscle are tightened in the midsection. The head of the bed then is elevated in a lounge chair position, and the skin is pulled down and excess skin and fat is cut out. The incision is closed in layers to obtain a hairline scar. The belly button is brought out and in the midline through a small incision and suture in place. I usually place a drain under the skin for about 5 to 7 days to prevent fluid or blood collection. For safety, I keep the patient overnight for observation and post-surgical care by the nursing staff at Baptist Medical Center, Jacksonville, to assure that they move and they have SCD device on their leg that massage the leg to prevent blood clot and receive IV pain medication. Tummy tuck should be performed when you are at your near ideal body weight. Although some skin and fat is removed, it is not a weight loss procedure. If you have it done when you are still overweight and lose weight after the procedure, you will have lax skin all over again and may need a revision. It is really best to get close to the ideal body weight before you pursue your procedure. Losing weight after tummy tuck will also result in losing intra-abdominal fat, and better tightening of the abdominal wall can be accomplished during the procedure. There are some cases where there is such a large amount of fat and skin hanging over the pubic area, making exercise and proper hygiene very difficult. In those cases, the excess skin should be removed, knowing that after weight loss, revision will be necessary. Mini tuck results in a shorter scar and no scar on the belly button, but remove a smaller amount of skin and only on the lower abdomen. The shorter the scar, however, the less skin can be removed. If you have excess skin or laxity above your belly button or muscle separation above the belly button, a short scar procedure is not the answer. It is better to accept the longer scar and gain a more complete result than go through surgery and still have some lax skin. If you have a C-section scar and a small fold and excess skin just above that scar, and the rest of the abdomen looks good, then you're a good candidate for a mini tuck. Thank you for your attention. I encourage you to browse through our photo gallery and read our patient testimonial. Hope to see you personally in the consultation and assist you to obtain the most beautiful contour body that you always wanted and you should get. Thank you.